Welcome back, everyone. So we've been watching the Jacksonville Jaguars. Our hearts get broken almost every week. They have had a tough season, securing only 2 wins this year. And players keep getting hurt on and off the field, and that certainly adds insult to injury. Quarterback Trevor Lawrence right now is dealing with an ankle injury, while running back James Robinson is facing a heel injury. So joining me now to discuss this a bit more is Dr. Candice Kennedy of Total Foot Care and Wellness Clinic. Appreciate you joining us today.
Good morning. Thank you so much for having me today.
Yeah, well, let's talk about this. So how do these injuries really affect play?
Absolutely. So they did a study back in 2018, and they basically sampled a number of NFL players and found that over 50% has sustained an ankle injury at some point in their career. So they're very common. And if they're not treated properly, this can result in long-term issues. And if they're not treated, correctly early on, it can also result in possible surgical intervention, which could prolong them returning to the field.
I mean, should we assume, though, these guys have access to the best of the best. They just have to kind of raise the red flag that they're in pain and then kind of start that treatment process. So he's probably getting that treatment. How quickly will he see, the full healing on this injury?
So it's, like you said, they have access to the best of the best. So, they've got a good team that is there on the field. They're going to see that they've had an injury and they're going to act on it very quickly. So on average, you're looking at about maybe 2 to 4 weeks, but sometimes it could take up to 4 to 6 weeks, just depending on the severity of that injury.
Right. Now, what about the heel injury? I mean, I've hurt my heel before. That thing is just painful.
Absolutely. So the medical term would be like a contusion, which is basically a fancy term for a bruise to your bone and or soft tissue. And that can actually be more painful and take longer to get over than a typical fracture or break. And again, you're always walking and putting weight on that area. So that's why it can take a really long time to get over without proper treatment.
I mean, I have to say, these guys, they're kind of gladiators. I always think of them as like modern day gladiators. They play till they break. So the heel injury, I imagine he's probably still going to do his thing, but it could get in the way of maybe some plays.
Yeah, so everyone's kind of heard of the acronym RICE, which stands for rest, ice, compression, and elevation. And rest is probably the most important thing, so that whether it's, a star athlete like the Jaguars players and or a weekend warrior that, loves to play basketball every Saturday with their neighborhood friends, rest is really important. And again, depending on the injury will determine how much time they would need to rest. Ice is also very important too, to kind of calm down any inflammation that's happening internally or externally. And then sometimes compression with like an ACE bandage, and then obviously elevation to try to get whatever swelling is in the lower extremity back up to the heart.
Yeah, Dr. Kennedy, I know some middle-aged men that get out there, like you just mentioned, on the weekend, and, it's like they forget they're not in their 20s anymore. So some things that you can do to really prevent some of these kind of more common injuries.
Absolutely. The biggest thing I try to tell the patients at Total Foot Care and Wellness Clinic is your feet are the foundation to your beautiful mansion. So if your feet are off, everything is off. And that could result in headaches, teeth grinding, sleep disturbances, back, neck pain, you name it. And so I really try to educate them on proper shoe gear, such as a New Balance, Asics, Brooks, things of that nature. I kind of talk to them about what they need to look for in a shoe so that when they go to the store, they're an educated shopper. I also recommend going towards the end of the day where we're all maximally swollen so you get a better fit. In addition, also speaking with your local podiatrist about a custom orthotic and or an over-the-counter insert. We try to get patients to steer away from, over-the-counter gel inserts and have a, professional such as a podiatrist guide them in the right direction. And then also just stretching exercises. A lot of people don't realize that they're walking around with a lot of tightness in their flexors. And so just incorporating some stretches that become their new normal, just like brushing your teeth. And then just making sure you're checking in with your podiatrist on a regular basis, because again, it's all about prevention and figuring out what do you love to do and how can we do it in a safe fashion without minimal injury.
That is such good advice. I think more people probably do need to see someone like you. So thank you for schooling us on this morning.
You're welcome. Thank you so much for having me.